Hi, I'm Kim with Stretch Physical Therapy and Total Wellness, and I want to thank you for opting in to learn more about sciatica. So most likely you are here because you think that you have sciatica, and this video is to show you if you have sciatica and you have pain when you stand up, that you could possibly be experiencing pain from stenosis, degenerative joint disease, or arthritis. Most likely you've got 50 plus candles on your birthday cake, and that pain when you're standing up goes down the back of the leg. Typically, most people say that the pain is right here in the upper glutes, and that they also feel pain over on the outside of the calf. Most people experience this pain when they're standing up, and typically will have to search out to sit in a chair after walking long distances because the pain just gets so intense standing up tall. You may also lean over on a grocery cart when you're at the grocery store to relieve that pain. That is also another indicator that you could be experiencing pain from stenosis, arthritis, or degenerative joint disease or degenerative disc disease. The worst thing about this pain is that the worse it gets, the more you're standing up tall, you're pinching that nerve, and the more you're pinching that nerve, you're causing damage, and it disrupts your life to where you find that you can't walk for long distances without having to know where a chair is every time you go out in the community. The longer you put off relieving the pain from stenosis, you may feel like your only option is injections, pain medications, or surgery. And this video is to show you that those are not your only options when seeking out care for stenosis, arthritis, or degenerative disc disease. That's why in this video, I'm going to show you 3 exercises. These exercises will help you relieve pain and pinching on that nerve while you're performing them. So I'm going to have somebody demonstrate these exercises for me. Megan, if you'll come right over and lay on your back. Okay. So you've most likely taken my 30-second sciatica self-test, and you feel like you do have sciatica, and then you found this video because you are experiencing pain when you stand up, when you walk for long distances. You may feel like you have to lean on a cart. If that's the case, then you most likely are experiencing pain related to stenosis, arthritis, or degenerative joint disease. And if you have that pain when you're standing up and need to sit down to relieve the pain, then these 3 exercises will help you right now. So I want you to find a bed or a table that you can lay comfortably down on your back. And I want you to bend both of your knees so that your feet are flat on the bed. And the first exercise we're going to do is we're going to bring your knee up to your chest, hold on to the back of your leg, and I want you to hug your leg into your body and hold that for a count of 5. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000. And then you can release that down. Now, when you're doing these exercises, I want to make sure that you're fully relaxed, because what is happening is when you're pulling that knee to your chest, you're actually opening up this area right here in the lumbar spine and that foramen and taking the pressure off of the nerve. So I want you to do 3 of those on each side, and we're going to go through those together. So bring your knee up to your chest, pull it in, make sure you're fully relaxed, hold it for a count of 5, and then relax. Now we're going to do 1 more on this leg. Make sure that you're fully relaxed and there's no tension, and then release. Okay, we're going to do the same thing on the opposite leg, bringing it up to your chest, squeezing it in, holding it for a count of 5, and then release. Only 2 more. Good. And 1 more time. Great. Now we only have 2 more exercises to do. The second exercise I want you to do is I want you to take your knees, keep them in this position where your feet are flat, and roll your knees slightly over to one side. That also is going to open up that foramen between L4 and L5. Hold it for a count of 5. and bring it back up to the center. Now I want you to do 2 more of those to the same side. Good. Again, you want to make sure you're fully relaxed when you're performing these exercises. Okay, back to the center. Good. And you want to make sure your spine is straight before you switch to the other side. Now I want you to come over to this side, open up the foramen on that side. And then just 2 more times for this exercise. Okay, very good. So those are 2 stretches that will help relieve the pain from stenosis, arthritis, and degenerative disc disease. Now I want to show you a stabilization exercise that we typically use in the clinic. This is called the pelvic tilt. And what you're going to do is tighten your tummy muscles, pressing your lower back flat onto the surface beneath you. You want to hold that for a count of 5, 4, 3, 2, 1, and release that. Now when you release it, I don't want you to come back fast. You want to press down, hold it for a count of 5, and then I want you to relax that. Now, do 8 more of those exactly the same way. Now while Megan is doing these, I'm going to explain a little bit about what is happening in the back if you do have stenosis, degenerative disc disease, or arthritis. Now, I've drawn a diagram here of the lumbar spine, and the lumbar spine is right here in your low back that connects down to the pelvis. Now we're going to be looking at the back side of the spine, and this is the front side of the spine. Now in here, on the back side, this is the vertebral body. There's a disc in between the other vertebrae, and then in between that, nerves are coming out. And that's where this sciatic nerve stems from, is L1 through L5. Okay, Megan, thank you. This drawing will demonstrate what you're seeing on this side, looking from the back to the front of the lumbar spine. The sciatic nerve is a group of nerves that come and start at L1 in between the disc and L2, and this red line is actually the nerve that it's going down, goes down to the pelvis, comes through this little hole called a foramen. But when we're talking about stenosis, arthritis, or degenerative disc disease, I've drawn out another figure. Typically, you'll have a doctor tell you that your stenosis or your arthritis is between L4 and L5, and that's your lumbar vertebrae 4 and 5. And in between there is a disc. Now, if you have stenosis, then this circle is actually the foramen in between the 2 vertebrae. And when those foramen are compressed, then you actually press on that nerve, and you're going to feel the pain coming right here out through the back of the leg. And this is the largest area of the sciatic nerve. It's actually the size of a nickel. Comes down and branches out on either side of the calf. Typically with stenosis, people feel pain right here in this area, and then they feel pain on the outside of the calf region running down the leg. If you know you have stenosis, degenerative joint or degenerative disc disease, as well as arthritis, you want to seek out treatment that will prevent you from going in and getting surgery, possibly taking medications for a long time, or having to get an injection. Now, the most successful route for treatment of stenosis that we found is manual therapy. And when you're seeking out treatment for manual therapy, you want to make sure that you're seeking out a physical therapist that does grade 5 lumbar mobilizations, followed by stabilization exercises and manual therapy that will help take the pressure off of the foramen. So when you're performing these exercises at home, you're going to get relief for a short period of time. What you're actually doing is you're taking the pressure off of the nerve. So when you're laying down and performing these, the pressure is off the nerve. However, when you go to stand back up and you don't have the mobility in the lumbar spine, the pressure is then, when you're in an upright position, right back on top of that nerve. When the pressure is on that nerve, you're going to have pain. So successful treatment takes 8 to 12 weeks with physical therapy. We actually help you relieve the pain. We improve the mobility in the lumbar spine and the pelvis, and we stabilize that area. We can actually improve the mobility, and when we do that and stabilize, then we can take away that pain, helping you to avoid costly surgeries that will have a long time for recovery. If you're not ready to take that route of 8 to 12 weeks of physical therapy and you choose surgery as an option, just know that surgery is only going to fix the L4-L5 region, and we're seeing patients come back to us because then they have to go back for surgery to go in and not only L4-L5 but fuse higher up, because if this is fixed, then the problem is going to go somewhere else. So your first choice should be physical therapy with a physical therapist that understands and specializes in stenosis, degenerative disc disease, or arthritis. If you're ready to fix that pain, great. Now I understand if you're not ready to fix the pain right now, you may have a busy schedule, or you may have a problem or have a high deductible that you have to pay for, and that's okay. But if you take the traditional route and you choose medications or injections, just know that you're going to be masking the pain and you're not fixing it. So there'll come a time that after the medication or the injection wears off, the pressure is still on the nerve. You've not fixed the root cause of the problem. So what's going to happen in your back is the muscles are going to shut off. And when they shut off, then you're going to have even more pain because you don't have the stability that your back is used to. You're going to have to end up with surgery. We want to avoid that at any cost and have you come in to see us, and we're able to do that by giving you a 100% free exam. So if you viewed this video, please give us a call at 513-874-8800. Schedule a free exam. During that exam, we're going to tell you if you do truly have stenosis, arthritis, or degenerative joint disease, and we're going to tell you what the problem is and then what successful treatment looks like. And during that, you're going to also get pain relief even on your first visit. The last thing we want to do is have you go through surgery and then come back to us and know that you have to go back in for another surgery. So pick up the phone, give us a call, and schedule your 100% free exam as our gift to you. 513-874-8800 is our number. If you want to learn more about us, you can check out our website at www.stretchphysicaltherapy.com. Let us help you get started on the road to recovery from stenosis, arthritis, and degenerative joint disease.